Hi, my name is Nelly, and I'm going to do a presentation on health promotion. And later on, I will do my campaign presentation, the one that I created. Yeah. So, yeah, let's get on now. Um, what is health promotion? Health promotion is a behavioral social science that incorporates elements from several different disciplines, such as biological, environmental, physical, and medical fields. Its aim is to protect people's health and improve the quality of life. Health promotion also allows people to take more control of their own lives. Advertising individuals about health lifestyles, choices, and measures to reduce risk is vital for preventing illness and accidents. Raising awareness, such as through ad campaigns, can deliver important information and encourage people to embrace activities that improve health and well being. I will speak about, for example, on mental health campaigns. It is estimated that a quarter of all ailments are linked to mental health. This impact this impacts one in every four people at any given time. Mental well-being can affect one's physical health, academic attainment, job security. Poor mental health has also Poor mental health also leads to higher risks of criminality and antisocial behavior. Health promotion programs play a crucial part in addressing the importance of mental health. They provide access to services and facilitate awareness of the self-care. There's a campaign that was launched in 2019 by the Public Health England called Every Mind Matters. Every Mind Matters initiative to help adults improve their mental well-being with NHS assured services such as My Mind Plan 2 and dispensing advice for individuals with mental health issues. The objective of Every Mind Matter is to provide people with necessary skills to support their own or others with mental health, and to recommend the courses for action to help address mental health concerns. This is achieved by providing guidelines on seeking help and supporting others alongside information access mental health services. You can call 111 and use option 3, I think, for mental health. And also, you can go to NHS Talking Therapies, which is available in person or online over the phone. Going back to My Mind Plan 2, it is a quiz which helps people to assess their mental health. It offers personalized action plan gathered from evidence-based self-help suggestions. The actions are then reviewed by experts for appropriateness and safety. We're gonna go to the campaign, which and safety. So My Mind Plan 2 shows people how to build simple changes in their lives, including reframing of unhelpful thoughts, breathing exercises such as mindfulness, and increasing physical activities. The impact of poor mental health can be profound, can have profound social and economical consequences. Mental health can prevent people from working, thus resulting in lost productivity and and the Health and Safety Executive estimates that depression results in 5 to 6 million lost working days annually. Moreover, the cost of lost productivity from depression is 23 times greater than NHS treatment costs. Other theoretical impacts include the extra responsibilities of family members in providing care, which this leads to a toll on the family, emotional toll on families, and further financial burdens. And also, it reduces the output of those unwell at work and alienation in youth with unresolved childhood issues and the poor cognitive development in children of mentally ill parents is also high. I'm going to talk about another campaign, which is the road safety. It was done by Think, which is a government launch. According to Think, drug-related deaths among drivers rose staggering 70% between 2014 to 2023. The data found that nearly 90% of impaired drivers involved in crashes were young men. And this campaign is for young men aged between 17 and 29. Yeah. It results in them being overconfident when assessing risks while the use of a substance, and were more likely to consider acceptable to drive following drug use if they felt unaffected. In response to sobering statistics, Think launched a road safety awareness campaign with a slogan, "Don't put drugs on the seat." Its aim was to alert drivers. No, I'm still on the. Its aim was to alert drivers to the dangers and consequences of driving. The key focus on the campaign was the driving seat and used a rotating camera effect to highlight the repercussion of drug driving on nights out, young lives, and their future. Such focus was an attempt to resonate with a younger target audience. In view of this, the campaign utilized several diverse channels in order to spread its message, such as out of home advertising, social media, online video, and digital audio. Whilst the campaign was national in its outreach, it focused on drug driving hotspots in England, coordinating its efforts with the law enforcement during the festive season. There is currently a strict zero tolerance policy to drug driving in Great Britain. Even trace amounts can lead to prosecution. Legal limits are intentionally set law to account for the accidental exposure. Thus, it is illegal to drive along after effects of drug use have faded. It is also against the law to drive under the influence of legal drugs that impair driving abilities, such as prescription medication. Potential sentences vary from 12 months driving ban to life imprisonment to death for death by careless driving. Other consequences of drug driving conviction include job termination, criminal record, high insurance premiums, and possible travel limitations. Thank you. Then I'm going to go to the health belief model. The health belief model is a psychological framework that predicts health behavior based on individuals' beliefs. It was developed in the 1950s by US psychologists in the Public Health Service to understand what factors influenced participation in disease prevention programs. The model assumes that engaging in health behaviors depends on the perceived threat and benefit of action. The key determinants include susceptibility, severity, and benefits of barrier, and self-efficacies. By understanding these various factors, it allows health professionals to sorry about that. It allows health professionals to have choices and utilize preventative measures such as vaccines and screening, thus reducing the risk of illness and enhancing well-being. The health belief model is used in health care and public health campaigns to simultaneously highlight the tangible benefits whilst addressing the key concerns, such as promoting vaccine by stressing the disease severity and vaccine's effectiveness, versus tackling cost issues and the fear of the side effects. The same concept can be applied to, for example, smoking cessation programs and healthy lifestyles. The advantage of the health belief model is to allow health professionals to design targeted interventions due to its clear understanding of health-related behaviors, such as health messages tailored to address individuals' concerns and motivations. This flexibility makes it valuable too in promoting public health education and lifestyle change programs. The health belief model does have its limitations, however. It focuses on individual, can neglect social, environmental, and economical factors. For example, individuals' belief in benefit of exercise can be countered by financial constraints or lack of access to suitable health facilities. Furthermore, the model assumes rational decision making, thus not considering the impact of habit, peer pressure, or emotions. Whilst the model is good at explaining behavior, it is unable to factor the intricacies of human decision making. So an alternative to the health belief model is a theory of planned behavior which emphasizes the influence of attitudes and subjective norms and perceived behavioral control on decision making. Unlike the health belief model that focuses on personal beliefs about health risks, the theory planned behavior considers social measures and individuals' perceived ability to act. For example, it explores not only the recognition of exercise benefits, but also the feelings of social support and control over exercising. Now, I'm going to introduce my campaign, which is on obesity in menopause. Where it is. Yeah, in menopause. And my the name that I came up with for my campaign is called Health Life with Menopause. The Health Life with Menopause Initiative program was launched in November 2025. It is aimed at raising awareness during the festival season about combating obesity in perimenopausal and menopause women. The Health Life with Menopause campaign targets women aged 45 to 55 years old, particularly from demographics with beliefs and behaviors that indicate a high likelihood of weight gain. The campaign will run on social media platforms such as Facebook and Instagram for 6 weeks. An app called What You Eat is What You Are will be created for users to download in order for them to access information on diet plans and alcohol intake, the limits of the alcohol intake while on the program, on the plan. This initiative will educate women on alcohol consumption and food choices and the dangers of eating too much sugar. It will encourage women to take charge of their diets and make sustainable changes to the eating and exercise habits, such as aim for a varied diet with colorful fruits and vegetables, incorporate whole grains such as brown rice and millet, include a daily mix of nuts and seeds, consume oily fish twice a week, or opt for nuts and seeds with omega-3, and prioritize lean or plant-based proteins. And regularly enjoy the beans and lentils and chickpeas, include fats like avocados and extra virgin oil. Health with menopause stresses the need of maintaining an active lifestyle and proposes economical and accessible methods of women to achieve this. For example, going for walks in groups or in pairs so that you're not bored, or if you're going alone usually can be boring, but if you pair yourself with your friend or in a group, it's more appropriate. Health Life with Menopause also provides support for women with perimenopausal and menopausal, including a range of interventions delivered online, by telephone, or workshops, peer support, and access to social media in their areas. And there's also a telephone number for those who want a phone or online with a website there, and also the individuals may visit their GP, who can make a referral to Health Life with menopause. I'm going to use the PENDAS health promotion to talk about the model of health promotion with regards to menopause. The reason for addressing obesity during menopause can be clearly understood when analyzed in relation to PENDAS health promotion model. This model focuses on promoting positive health behaviors by examining the factors and the influence at an individual's decision to engage in healthy lifestyle choices. It is mostly relevant in menopause because women experience significant biological and psychological change that can increase the risk of weight gain and associated health complications. Oh, and in my campaign, because why it tackles with obesity is the repercussion of obesity in menopause can lead to diabetes, heart problems, and the likes. Yeah. And menopause is associated with hormonal changes, particularly a reduction in estrogen levels, which can lead to increased fat accumulation and metabolic changes within the PENDA model. These changes are recognized as biological that influences health behavior. It is therefore important because this stage of life presents increased vulnerability, requiring tailored health promotion and interventions to lifestyles and modification. Thank you very much for this presentation.